Hello, everyone. Dr. Christine Smith back for a really interesting interview for you today with Dr. Soyona Rafatjah. And she is a conventional family medicine doc who is also trained in functional medicine. And she's been doing a lot of work in gut health, but she also works in hormones and autoimmune. So I just thought she'd be a really wonderful person to have on because you guys are always asking me, like, how do I find these awesome practitioners? And she's just another one that I know. And we wanted to talk about gut health because it is the foundation of this goes for autoimmune, this goes for IBS, this goes for brain health, even cardiovascular health. Like they are all related and all tied back to gut health. And our gut is amazing. It has as many neurons as a cat's brain. So let's dive into that more. Hello, Dr. Rafatjah. Thank you for joining me today.
Hi, thanks for having me. Hopefully the internet will cooperate with us.
Absolutely, yes. I think this is already looking better.
Awesome.
But I was just kind of telling everyone a little bit about you and just about why gut health is so important in all these conditions that we deal with. So I'd love if you'd share a little bit just about yourself and how you kind of ended up in this niche and this passion.
Yeah, I'm really excited to have this conversation today. I think you started talking about how important gut health is, and I'm super excited to dive into that.
I know you've been doing
I'm
some cool research around it too.
yeah, definitely. I'm excited to bring that to everybody. And yeah, so just a little bit about myself. I'm a board certified family medicine physician, and I also study integrative and functional medicine. And I got into this originally wanting to help people and find the intersection between science and humanity. And I really feel like doing integrative medicine and really intersecting conventional approaches like medications and prescriptions with the humanity side of things, of digging deep and actually trying to get to the root of things and using nature and herbs and more natural approaches. That kind of intersection is really where my passion lies. And so we have a clinic in Denver, Colorado. It's called PrimeHealth. And we do exactly that. We work with people, we try to get down to the root of what's going on with them. The gut is a huge part of healing for most of the people that we work with. The majority of people we work with have some kind of underlying gut disorder, whether they know it or not. And so we uncover the layers of, what might be going on with them and what might be causing their symptoms or making them not feel their absolute best. And we try to get them to feel better. And much of the time it does work out, which is amazing.
Absolutely. I love that. And that's essentially the way I work as well, which is why I wanted to do this talk. And I would love, just as someone who has also been conventionally trained, you know, for you in your learning process of kind of shifting into this more natural, holistic form of care, what have been some of the like really big differences or things that you ran into that were just a huge transformation of perception for you?
Oh, yeah. I mean, when I was in medical school is when my mind really opened up to integrated functional medicine. I was really fortunate to have amazing mentors at the University of Miami in Florida who were deep into integrative medicine, even like 15 years ago when it wasn't really cool. And so I was taught early on, like, hey, did you know like PPIs, these acid blocker medications, they can actually cause SIBO or small intestinal bacterial overgrowth. I had this surgeon mentor. He was like in his 70s and like had this passion for like studying the gut and studying integrated and functional medicine. And so in medical school, I was being exposed to these concepts of like, medicines can actually cause problems sometimes. They're not always the answer. And in my training in residency, it was like, okay, a pill for every ill. Like every time you have a patient come in, we want to know what medication you're going to prescribe. And it was like so competing, these thoughts that were like being thrown at me. But I knew in my heart and in my soul, like that the truth was there. And the truth was that you do have to dig in, and medicine is not always the answer. And there are, problems that can occur when you prescribe. And that was really eye-opening for me to have like well-trained surgeons, like really legitimate medical doctors telling me that they believed in these types of approaches. And I was like, okay, well, there's something to this, and I can really put all my eggs in that basket.
That's so warming to my heart because I think a lot of people are really jaded with our healthcare system, understandably. But also, it's like I have such sympathy for the doctors that are working in it because they work so hard and are, like barely have any time and are kind of, have all these guardrails of all these rules they have to follow. So it's like I can really understand both sides, but to know that there's the interest in conventional medicine growing in the, holistic and functional model, which ironically so much of it is lifestyle medicine. It's really going back to like our old roots before our, more industrial medicine came around. And if you
Yeah.
really look back at like old medical textbooks from like before the 50s, it really is more like holistic functional medicine concepts. So
Yeah.
great to know that that is coming forth in our current conventional training. So
Absolutely.
I wanted to kind of dive into, because I know you've been working on some really interesting cases and some interesting research. I wanted to dive in a little bit about like what have been some of the cases you've been working with lately that you've just found the most interesting, and what were some of the differences that you applied in their customized care, because everybody's different in their needs.
Yeah, definitely. And I mean, even before jumping into cases, I did just want to like chat a little bit more about the gut,
Yeah, let's
like
do it.
why,
Perfect.
why is it so important? Because I think there are some statistics that have shocked me when I've heard them that I think can really help illustrate for people, like, why do we care so much about the gut, And we hear this all the time from like Eastern and Western medical, you can think about it from either philosophy. Like the gut is the center of our health. And it's not just physically in the center of your body, because it is, but it actually like it forms your immune system. Like the majority of our neurotransmitters are made there. It's actually the largest surface area in our entire body that we interact with the outside world. And like that's kind of a hard concept to get your head around when you first hear it. But basically, if you think about it, your gut is on the outside of your body.
I
Right?
always
Like
like
you
to tell
understand this.
people we're like a donut with a hole in the middle, and food that you eat from
Yes.
the environment is still outside of you until your body decides to absorb pieces of it. But then what we excrete never actually was inside your body.
Right. It's incredible. It's an incredible, crazy, crazy concept that I think is fascinating. I mean, when I heard that, I was like, oh my God, like something actually clicked for me. Where you're literally taking the outside world and putting it inside of your body. So this is your interface with the world. So anything that you interact with in your environment, inside or out, is going to be affecting your gut and vice versa. So that's incredible. And the surface area of that gut interface is the size of a tennis court. And the reason is because you have these tiny protrusions called microvilli, yeah, like finger-like projections, right, that line the small intestines. And when you spread it all out, I mean, it's another concept that is so hard to even wrap your head around. It literally is the size of a tennis court. Like that is how much of our body is interfacing with the outside world through our gut. And like you said, there's enough neurons that are in our gut that's the same as a cat's brain. That's such an amazing analogy. And it's actually more than is in our spinal cord. So there you go. I mean, I just really want to just lay out, that is some amazing information about our gut, and like hopefully illustrates to people why, as functional doctors, we are so obsessed with the gut. Like it is truly an obsession.
Oh, absolutely. And even if we tie into it in like more of an energetic way, right? Because I think we have this tendency in our world to just kind of get locked into like our day to day and our logical mind, but like we forget what profound creatures we are. And if you start thinking about the gut in that way, you start thinking about the neurology in those areas, and then you start thinking about, things like our energetic system, or even really old school thinking like chakras. It's like that's where our power center
Mm,
is, and it is our
mm,
fire center, right? It's our ability to digest life. And
mm.
that is so much more than just digesting food. Like just
Mm.
like you said, it's the whole interaction with our outside environment. And that's why when we have emotional struggles, it can totally affect our gut. And you can
Yes.
actually get leaky gut from being stressed out. I'm sure we'll dive into that a little bit. But yeah, I'd
Yes.
love to just hear some of the things that have been most interesting for you lately that you've been working on.
Yeah, absolutely. I mean, there's so many cases that we could talk about, but I would love to highlight a couple. There's a couple diagnoses that I feel like need to be out there in the world a little bit more. And people need to recognize that there is hope, there is a cure. Like for instance, a few things that I think we could touch on. One would be IBS, irritable bowel syndrome, one of the most common diagnoses out there. The other one would be mast cell activation syndrome, something that most people probably don't know about,
It's more
but
common these
more
days.
people are starting to get aware of it. Yes. And then the third one would be just chronic autoimmune disease. So, you and I know as functional doctors that these things are reversible. Like there is a cure for a lot of people suffering with these kinds of conditions. And yeah, I would just love to touch on a few things. Like, first of all, IBS, irritable bowel syndrome, incredibly widely diagnosed. Millions of people around the world have this diagnosis of irritable bowel syndrome. And, what does that mean? Like, in conventional medicine, like I said, the way I was trained, it's like a pill for an ill. It's like, okay, well, you've got irritable bowel syndrome, try this medication. And that's usually the conventional approach is like, okay, well, let's try to use this to, a laxative so that you can poop more often if you're really constipated. Or we'll try to give you something that suppresses, the nervous system in your gut so that you won't poop as often if you're having chronic diarrhea, or XYZ medication to kind of like hijack the digestive tract of what it's doing. It's not like, the functional medicine approach is let's get inquisitive about this. Like, let's get curious and lean into why your gut is behaving this way. That's the way that the functional medicine approach is. And so we'll do stool tests, and we will do, breath tests to see if you have SIBO, and we'll talk to you for 2 hours and listen to your story. Yeah.
And I just like, I think it's so important what you just said of like listening to everybody's story, right? Because not everybody's in the same place. And I just want to throw in like a couple terms so that, as practitioners, we are appropriately following all the terminology rules. So everything that we're going to be talking about here is essentially education about your physiology so that you can learn how to regulate your own system. We are going to be discussing some diagnoses, but one of the things with functional medicine is like, you're not always diagnosing something because sometimes you're catching something before it has tumbled into a diagnosis, which is also why insurance won't always cover functional testing, because to get insurance to cover things, you have to have specific diagnosis and specific codes. So this is like where functional medicine kind of exists in this gray area of preventative medicine, of catching people before they fall into these things. Now, when it comes to autoimmune and things like this, we have to be careful about when we say the word like cure, right? So, but we can say, we can teach you how to manage your body so that you no longer have symptoms, which is essentially maybe kind of close to the same thing, but terminology wise, we're just saying like we're teaching you how your physiology can go into remission when you have had other autoimmune symptoms. The other part is none of this is medical advice. Please consult your practitioner, but we really want you to understand how your body works. So just wanted to throw those little tidbits in there.
Yes.
Please continue.
Yes, of course. And all of this is personalized. It is really important to work with someone one-on-one if you possibly can. But yeah, so IBS, this is something, it's actually called a diagnosis of exclusion. That in, medical terms is basically we've checked for everything else. And yeah, we're throwing our arms up and we're like, I guess you got IBS. And so in medical school, we actually also call that idiopathic. And it was really funny. I always remember this lecture. It was like my first year of medical school, and this doctor was teaching us about the word idiopathic, and IBS is one of those diagnoses. And he was like, it basically means your doctor's an idiot and your patient's pathetic. And I was like, oh my God, that is really funny and sad at the same time, and kind of true. But yeah, I mean, it's literally like we don't know what's going on. Sorry, it's one of those. And in the beauty of functional medicine, why I'm so passionate about this is because the majority of cases, we will be able to help you reverse your symptoms. And, whether you call it cure or not, I mean, you will be feeling like a normal individual and eating normal foods, and no longer, having to run to the bathroom, having to, wait 3 days before bowel movement, all these other symptoms that people might have. And the reason is because there are a multitude of reasons why people have IBS. And that is the secret. That is the secret to the entire thing, is that there isn't one reason why someone has constipation. There isn't one reason why someone has bloating or diarrhea. There are a number of reasons why these things can happen. It's not a, Linzess deficiency or XYZ medication deficiency. It's maybe this person does have mast cell activation. Maybe this person has a parasite that they've been living with for a decade. Maybe they have SIBO, or small intestinal bacterial overgrowth, or candida, or like a yeast overgrowth, or a food intolerance that they were unaware of, or a toxicity, that they were unaware of. These can all be causes of irritable bowel syndrome or IBS or any digestive or gut disorder. And that's what we do in functional medicine, is that we try to dig in. We do a lot of in-depth testing. And of course, there's a lot of buy-in on the patient side, as we know. You do have to be willing to make an investment and spend, a few $100s on a stool test, and then, pay out of pocket for advice and medical, visits and things like that, and changing your diet. These are things that as a patient, people do have to buy in.
And one of the other pieces I'll add in, just because I think this is a good mindset shift that society needs to have. So one of the things about our insurance model, like I absolutely will use it for an emergency, right? Like I think that is definitely what it's there for. But we've been so tied into, I'm only going to do it if my insurance covers it, but then insurance is really limited. Being like $30 for a copay, that they start to get upset when their copay is in the hundreds. But you also just spent like $300 on your haircut. So I'm at the point where I think you should value your health more than your haircut. I'm just going to put that out there.
100%. I think, we are also living in a society where we have grown up to believe that you fix it when it's broken, right? Because that's what medical insurance pays for. There is no coverage for preventive. Like you said, like catching things early, that is the most important thing. And like in every aspect of health, like I know that this is going to change, because we've kind of hit one side of the spectrum where we're so far gone from preventive health that it's going to have to start going in the other direction. I can feel that happening. Even in the most conventional areas, like people are starting to want that preventive approach. So yeah, this is so worth the investment, but it does take buy-in. It takes time, it takes money, but believe me, like after decades of people dealing with IBS, they are so relieved to finally feel that relief. And just to go into a couple of cases that I think are really noteworthy, mast cell activation syndrome, for instance. So this is obviously a podcast of its own, or, an entire hour weekend course. But mast cell activation, it's super complicated. It's not a well-known diagnosis, unfortunately. However, a lot of people have been bringing it to, the attention of doctors and patients, and it's all over the internet now. So I think it's getting a lot more attention that, it is worthy of. And it basically means that these immune cells, mast cells, are opening up and releasing like hundreds of these different chemicals into your bloodstream inappropriately. And normally mast cells are great. They're basically present at the interfaces with the environment. So it'll be our nose, our eyes, our gut, those are like the main places that we interface with our environment. And so mast cells are aligning those surfaces, and they're scoping out for anything that's, toxic or something that shouldn't be there, some kind of a threat. And so your mast cells might be overactivated. They're kind of activating to foods that you're eating, or they're activating to chemicals in your environment that normally don't activate other people's mast cells. But that activation is basically causing what's called degranulation. It's opening up like hundreds of chemicals into your bloodstream, including things like histamine, and then causing this kind of like histamine reaction. Some people have typical histamine reactions like allergy and sinus type stuff, itching, like typical like allergy symptoms, like you would think. But some people have really, really strange symptoms, like for instance, gut disturbances. Could be in the form of constipation, diarrhea. It really depends on the person. But when we do an intake and we see this kind of constellation of symptoms and kind of put it together that, okay, mast cells may be the culprit here. Sometimes you can do diagnostic testings that help us, but there isn't like a specific necessarily like diagnostic criteria that hits the nail on the head every single time, unfortunately. And it can get really expensive to run these kinds of obscure tests. So a lot of times it's diagnosed based on history. And we might try certain things. And so some of the things that we try with our patients, it might be like mast cell stabilizing substances. And some of those things can be in the supplement form, like quercetin, vitamin C, luteolin, things like that help actually stabilize mast cells. We can also try to dig in and see why these mast cells are being overly activated. That's really the key, and that's how you really can find a long-lasting relief from your symptoms, is by looking, is there a toxin in your system? Is there an infection in your system? Sometimes things like gut infections or heavy metal toxicity or mold toxicity can be the underlying culprits of mast cell activation. And sometimes, even when you correct for everything and all the detoxification happens and all of that stuff, sometimes people just have really overactive mast cells, and it can be really hard to live like that. So we will sometimes use pharmaceutical medications, but they're not the type of pharmaceutical medications that cause any kind of harm. They're really, like, for instance, we'll use something like cromolyn sodium, an oral form of cromolyn sodium, which is a mast cell stabilizer. And that's pretty much all it does, is stabilize mast cells in the gut. It doesn't really have side effects otherwise at all, as far as I've seen or read or anything. So that can be like a magic, honestly, like a magic pill type situation for some people, with this mast cell activation. But it's like, unless that's on your medical provider's radar, they're never going to even think to prescribe that for you. So that's why it's so important to come to providers that are more educated in this type of more nuanced, gut healing approach. I also have a really amazing case of an autoimmune condition that, this was last year, and she had a multitude of other issues going on. But the main problem was that she was having daily vomiting of bile. So like green, like dark green bile, vomiting. And she was worked up at Mayo. She had an intensive workup. And she was diagnosed with primary sclerosing cholangitis, which is PSC for short. Most of us see maybe one or two cases of this our entire lives as medical doctors, because it's so rare, unless you're a hepatologist, a liver doctor, because they actually see this way more than any of us. But and then like it was interesting because her diagnosis wasn't even 100%. Like one doctor thought it was primary sclerosing cholangitis. Another doctor thought it was primary biliary cholangitis, cirrhosis, primary biliary cirrhosis, PBC. So anyway, these are just, really rare liver and bile duct conditions that you don't want. It's basically, they told her like, okay, you're going to have this for the rest of your life. If it's the PCS or PSC diagnosis, you could actually even be at risk of developing gallbladder cancer, in the future. So, terrible prognosis with either one of these. So then she comes to us, and of course, the first thing I do is, what are you eating? What is going into your gut? I'm no other doctor has asked her that. Like, it's just baffling. It's just baffling. Like, you're going to these GI doctors, liver doctors. What is actually traveling through your digestive tract that could be causing this problem? And there were so many things. She's eating tons of processed food. She's drinking soda every day, like high sugar, like Coke. It's just food after food. And so we clean up her diet. We put her on a detox protocol. We put her on a gut healing protocol. We put her on our Prime Shake, which is like a plant-based protein shake that has a bunch of antioxidants in it. Drink water, don't drink soda anymore. If you crave a soda, then you can have a Zevia, or a St. Virgil's, or, one of those like stevia, sweetened sodas that are not too terrible for you. And I saw her back in a few months, and within just a few months, her liver enzymes went from like the 200s down to like the 50s. And it was like, okay, like, do you actually have an incurable disease, or are you just feeding yourself frankenfoods? And your body's like, what is happening? Of course, I'm going to, try to get rid of it in any way I can. And if it still keeps coming in, then yeah, I'm going to have vomiting episodes, and like my gallbladder and my liver are going to be really angry with me because they're trying to detox all these chemicals that I've never seen in the millions and billions of years of human life before. And so that was a really fascinating case. Unfortunately, she's so complex, and she has a lot of mental health stuff going on that's also a huge component to her physical condition, that it's going to take a lot more than just the diet change to sustain her optimal health. But it was so clear, just within a few months of changing her diet, detoxing, healing her gut with nutrients, that she was able to reverse that liver inflammation. And if she sticks to it, she's no longer my patient anymore because of a need for more mental health care. But if she does stick to this plan, I know that she can completely resolve her liver inflammation, which is absolutely incredible.
Well, it's amazing when you see those cases. Like, no matter what supplements or medications you give someone, if they're still filling their body with poison, it's not going to work. And so that's, kind of one of the things we run into with conventional medicine is it's like we have these things that can help symptomatically and buy time, but they never ask you about your lifestyle or your diet or what's going into your body. And
Mm-hmm.
I think there's a really simple way to think of foods, because people are always like, what diet do I do? Well, my answer is always the one that's right for you, which varies from person to person and can really be based on how your immune system is reacting, because you can develop immune
Yes.
reactions to innocuous things like eggs. Like, I love eggs. They have great health benefits and choline and other nutrients that we really need. But you can develop sensitivities to them over time, depending on what you've been through. And if you're eating those things that inflame you, then it can be a problem. So that's the people who are like, I've already done the healthy diet and it's not working for me. What's going on? That's when we dive a little deeper into those things. But if you're drinking soda and you're, eating highly processed foods, it's not ideal. Even if you're gluten-free eating processed foods, sometimes that's
Right.
even worse. Or even if you're vegan eating processed foods, that can be worse. Like, a lot of
Mm-hmm.
vegan stuff is actually made with like GMO soy and vegetable oils and
Yes.
highly inflammatory things that are actually worse than, if you were to just eat red meat, which red meat is actually not that bad. That's kind of one of those things where like sugar or fat used to be the bad guy, and then we figured out it's actually
Mm-hmm.
sugar. It's like red meat used to be the bad guy. Now we're figuring out it's not actually really the bad guy. So if it walks, swims, flies, or grows, you're usually in a good place. But also,
Absolutely.
if you're eating meat, you have to be careful what your meat was fed before you ate it. So that's one of the
Right.
other pieces. But this is great. Thank you. I'd love to hear more.
Yes, yes. I mean, so those are two really, I just think that they can be really hard diagnoses for people to hear, or just not even get diagnosed appropriately. So I just wanted to mention those three things, like IBS, mast cell activation syndrome, autoimmune conditions. You may get these labels or be misdiagnosed and be told maybe that you have to be on a medication for the rest of your life, or this is something that you're going to have to deal with for the rest of your life. And I just want people to know that there is hope. You can seek medical providers that know functional medicine, that dig deep, that do the extra tests and go that extra mile, and know how to combine conventional medicine with integrative and functional medicine so that you can get the best of all worlds. And something else that we use a lot with our gut health patients is actually peptides. Like, we'll use BPC 157 a lot of times with our gut patients, and they do super well. And I think that peptides are getting a lot of attention right now. Like, they're getting a lot of attention mainly in the, I would say, anti-aging world, and in the kind of longevity and biohacking and maybe even like muscle building world. Like they're kind of like in that category right now, but we use it in functional medicine all the time, in various ways. So for gut health, like BPC 157, a lot of people hear about this peptide because they're injecting it and they're trying to get the collagen building gains from that. So either like muscle injury or injury after, repair of an injury from like excessive working out or from surgery. We'll use it in those cases. But keep in mind, this peptide, it's actually called body protecting peptide. It was found in gastric juice. That's where it was originally isolated from. Human gastric juice. It's created there. And the main purpose that we think it's like, who knows, the creator or whatever made this is because it's like healing like micro, ulcers or any kind of like damage that occurs in your gut. It's going in there and it's repairing, because what's your gut lining made out of? Collagen. It's the connective tissue of our entire body. And so that's really fascinating. We can use it in the injectable form so that it goes to like injury or repair and things like that. But we can also use it in oral capsular form, and that will go straight to your gut and just dump out all these signaling peptides to build up collagen and heal your leaky gut. So that can have implications for gut health, and it can have implications for autoimmune disease too. Because as we know, the gut is where the production of 80-90% of our immune cells are. And therefore, if we have a leaky gut or inflamed gut, we are going to be at risk for developing an autoimmune condition. And if we have an autoimmune condition, it is 99% likely that you have a leaky gut. So, putting these things together, if you heal the gut, you can generally improve autoimmune conditions, even if that autoimmune condition is affecting your brain or your skin or any part of your body that seems to be potentially disconnected from your gut. It is not. It is actually very intricately connected to your gut. So that's a really interesting tool that we've been using lately and seeing some good results.
Peptides are super interesting. They are like their whole own universe of stuff. I'm sure we could do an entire another talk on them. But with keeping those things in mind, I think everything you're saying is so on point. And I saw someone say earlier, like, it's amazing the mental place of that we can get into from eating poorly long term, where people are used to feeling that way. So you don't even really know that you have this tension in your body and that you've had a stomach ache for 10 years or that you've had brain fog for a decade. You just live there and this is just how you are. And then it's like when you start to make these shifts and your brain turns back on and you don't have a stomach ache anymore and you don't gain 4 pounds overnight, like when you eat something because you've retained a bunch of inflammatory water weight to it, you start to realize how you could feel. And then this is where you get the motivation for this stuff, right? Because it's really, really hard to make these changes in the beginning because it just feels like someone's telling you what to do, which is part of the reason that we like to do these talks, is so that you guys can understand why you're doing stuff. And I think that's a much more powerful internal place to come from. And then when you do it for at least 2 to 3 weeks, like minimum probably 3 weeks, then you actually start to feel a shift. And it's so funny because people do a cleanse for a month, but it takes a month for your biochemistry to turn over. And so right at the end of the month, everyone's like, my cleanse is done. I'm going to eat all the things again. Right as their chemistry is turned over, then they start consuming all these things that were irritating them before. Versus if you can make it go for like 90 days, that's when your body really starts to have a huge transformation. And when you get to the point where you feel really good, and then you eat a slice of pizza and you're like, wow, my brain just turned off. I'm super bloated. My gut felt terrible in the morning. I'm kind of cranky. And then you start to realize that these things can come from something that you put in your mouth. You get more and more motivated to shift.
Oh, yeah.
And I think it's a long-term thing that you just do over time. You start kind of transforming your lifestyle, but it all starts with education like this, because if we can do this and prevent the gut from getting inflamed, where your immune cells hang out and go to get trained on how to operate in something called Peyer's patches, which is like their little clubs that they hang out at. If you have an inflamed gut, they're going to be trained to operate in an inflammatory way. And so if you have an inflamed gut and then you have an inflamed immune system and then it overreacts to something and then it makes your gut more inflamed and then you have a more inflamed immune system and it keeps going, this is how you end up with autoimmune 5 to 10 years later. And then you're like, this came out of nowhere. It's like, no, it came out of the last 5 to 10 years of being stressed out, eating poorly, not listening to your body. Like our bodies speak quite loudly. We just have to remember how to listen to them. And I think you said that you've dealt with like some autoimmune cases you've been working with, or like any other cases you want to talk about before I go into our next question.
Yeah. No, but I would just touch on that. Just one thing to add is that, yeah, because our guts are so intricately connected to every single system in our body, it can be a herald sign, right? Like having IBS could be the first sign that you may develop an autoimmune condition in 10 years or 20 years. So like that's why correcting the gut issue is so important, because that could be the herald sign of something more serious down the line, even like a heart attack or Alzheimer's or XYZ condition, that if you heal the gut, it's going to prevent that from happening. So that is really an important connection to make.
Absolutely. And that goes definitely for the mast cell activation syndrome that you were talking about. Like if you get, like, for anyone who doesn't know about it, like it's kind of hard to explain, but I went through it when I had a mold exposure. It is miserable. Like talk about an allergy. It's like an allergy on steroids with the Hulk. It's like your entire body just reacts to everything. Like something will touch your skin and you'll get a rash, or you have like hives that just like literally make you want to rip your skin off, or like your brain just won't work. You're just living in this fog and you're just sensitive to everything. And like, you smell somebody's perfume and you like can't even handle them walking by you on the street. And it's like when you start to get really chemically sensitive and you're dealing with this stuff, that is totally a check engine light. There's something going on in your body. It's often associated with a chemical exposure. Like mine was mold. It can be from other things. It can also be highly associated with an emotional injury. So something like grief, like a massive amount of grief can be highly tied to things like mast cell activation syndrome. And this is one of the things I'll see in my cases with people is they'll have done all of the physical and chemical things to address it, but no one has done the emotional work with them. And sometimes it's therapy, sometimes it's like body work and a physiological release of whatever emotional stress that you're storing, which isn't always verbal. Sometimes it's like a physical release. And so just understanding that that can be a piece of these things, especially in stuff like autoimmune. There's a whole book about it called When the Body Says No by Gabriel Monte, who's like the
Love
father
it.
of trauma. And so just know that there's a bunch of really interesting things that you can investigate, because if these things come up, just like she said, it's a precursor to other conditions. They've even shown that things like Parkinson's can result from weird proteins going in retrograde, meaning backwards transport up the vagus nerve from the gut back up to your brain. And then you start dealing with like weird protein issues in the brainstem, and then you start getting weird autoimmune conditions. But that happens 40 years down the road. So if we can catch these things early on, you can live a much longer and happier life where you are thriving instead of just surviving. So love that. Thanks for all the work you're doing. It's great.
Thank you.
Yeah. And so we kind of were talking about this a little bit of like, what other conditions do you find gut health is tied to? Anything else you kind of just want to comment on that, and things you have found intriguing in practice?
Oh yeah, absolutely. I mean, one thing that I think people are starting to recognize a lot more is that the brain connection to the gut, kind of like what we're talking about with Parkinson's and everything. I
Depression
mean,
and anxiety.
yes, mental health disorders. So, I mean, I could even bring it back to that patient I was talking about with the bilious vomiting, vomiting bile. Like, yes, it was connected to inflammation, right? And like we could tie up like the physical parts of that. But we also realized that it was like every time she had an argument with her extremely controlling dad, that was always a trigger for her to have these like vomiting episodes. And it was like, and so you have to address that mental health component. And there are certain people in my practice, like I've had, for instance, someone else who had an autoimmune condition, psoriatic arthritis. We did a psoriatic arthritis and also skin lesions. And we did a lot of detox, gut healing, peptides, that all helped a ton. But then she ended up doing some psychedelic journeys. She started doing psilocybin microdosing, and that seemed to really tip her off in the right direction. So, having that realization that your psyche and the way that you think is so intricately connected to your physical form and your body, and especially your gut, that is so important. And I think that, something that a huge message that we're kind of trying to impart here with this whole conversation is like, there is a cure, like there is an answer. Like, don't ever stop. Like, just because you go to a conventional doctor and they tell you, XYZ diagnosis, I'm sorry, like go on your way, or like, I don't have anything I can do for you. Like, that is not okay. Like, that is not an answer. Like, you can find hope. You can find a functional medicine practitioner like Dr. Christine or myself at PrimeHealth. We see people resolve issues that seem incurable or deemed incurable by some physicians all the time. And there's one book that I used to actually give to a lot of my patients, and I still recommend it often. It's called Cured by Dr. Jeff Rediger. And he mostly focuses on cancer and autoimmune conditions, because those are the conditions that most people are told, I'm sorry, this is incurable. But even things like IBS, even things like mast cell activation, like all those things, like people think, oh my gosh, like I'm going to have this forever, but that's not necessarily true. And he has 4 pillars of health that he mentions, and I want to mention them. So the first one is healing the immune system, which of course we know is in the gut. Number 2 is healing nutrition, so cleaning up your diet. Number 3 is healing the stress response, which we've been talking about a lot, and like how the brain and mental health affects the physical form. And then the 4th one is super interesting, is healing your identity and how you relate to yourself in the world. So that is a little bit more esoteric, and like, kind of brings me back to this whole like psychedelic journey and psilocybin microdosing that this one woman was able to, see a lot of benefit in her psoriasis from. So, that's just another invitation to kind of like look within, look at how you feel, what's your self-talk like, how you're spending your morning, and like, what are you waking up and going to sleep thinking about? Like all of these things that affect our everyday that, conventional doctors may not put so much emphasis on, but Dr. Rediger, who wrote that book, he is a conventional doctor and like did a bunch of research, and that's the conclusion that he made. So it is fascinating, and it's really amazing. And I love that as functional doctors, we are looking at the whole person, and we are taking all these things into consideration. Like, yes, we'll put people on a supplement protocol, and we'll, change up your diet and talk to you about all the physical things that are, really objective and laid out. But we will also talk to you about your stress and your home life and all of those things, that are so important for your overall health.
I think what you just mentioned about identity too, it's like one of the things that I have found when you have a health crisis is it's a bit of an identity crisis, especially if you're like an active person or
Yeah.
someone who's always had, like skin that you haven't had troubles with, and then all of a sudden you have this huge rash and you like don't feel like yourself anymore, and you feel unlovable, and like these crazy feelings that you can run into. And then it's like that identity crisis creates more stress, and it sets you on this like cycle of making the system worse, because people also often forget. Did you know that when you're stressed out, your gut actually grows dysbiotic bacteria because they have receptors for your cortisol? Yeah, stress actually gives you
Yes.
leaky gut, as does spraining your ankle or getting in a car accident. You actually get leaky gut from these things.
Mm-hmm.
So this is a lot of what I teach people about, is like how to know when your body is in an injured state and be able to address it. And, I want to address like questions that are coming in too. Someone had a question of like, what do you think about when the body resorts to fermenting everything and then mold grows on that fermenting food in the gut? I think it's a little bit more complex than that. I would go back to, if your body's fermenting everything, you're probably dealing with some kind of SIBO. You're probably not digesting your food correctly. So we would have to check on your digestion. Why are you not producing enzymes or hydrochloric acid to be able to digest your food? What food are you trying to digest? Is it actually food, or is it Doritos? And are you, and then if, there's mold growing on it, it's like, well, are you consuming a lot of moldy things? Do you have an environmental exposure to mold? So it's usually not just like this thing that the body's doing. There's usually a lot of pieces tied in. And also, are you super stressed out and your gut has no motility because you're in a fight or flight state, and the last thing your body's thinking about when you're running from a tiger is digesting your food? So if you are in a fight or flight state and your nervous system is in that state, I'm not even going to give you nutrition yet, because you can't absorb it. Your cells are in what's called a cell danger response, and you can't actually process that nutrition. And that'll be a lot of clients I see. They'll be really sick, and practitioners will just put them on a ton of supplements, and they can't even properly process them, and then it makes them
Hmm.
more sick. And so just know that there is an order of operations to things, and it is very different for everybody.
Yeah,
Um,
that's so
yeah,
true.
any thoughts on that before we jump into our next question?
Yeah. When you mentioned cell danger response and like being in a state to actually be able to heal and receive, supplements and things like that, there's a really interesting app called Nerva. You heard of this yet? It's
Mm-mm.
kind of on the newer side, but they actually have research backing it up for improving IBS, like in 80+% of cases. So they'll actually have you run through a series of questions before you start, and based on how you answer the questions, they'll give you a percentage of likelihood that you will resolve your symptoms within 6 weeks of use of the Nerva app. So it's super cool because they're actually giving you like, I guess, a kind of personalized blend of like meditations and almost like hypnosis, maybe, kind of like I haven't done it myself yet. I'm interested to see what it's like, but we have a number of patients and even like staff members at PrimeHealth that have been using it and seeing really good results. So that's another really good tool for our IBS patients.
I love that. And you guys, there's so many resources out there for you. That's why we want to do this, like to let you know about the resources. So when it comes to, the perception of the world and mental health side of things, if I had to pick the most important part of health, and if I could only treat one thing, it would be your perception, because that is what produces the chemistry in your body. If you are perceiving yourself as a victim in your life, you are going to produce chemistry that is inflammatory. If you are perceiving yourself as a capable person facing a challenge, you are going to produce beneficial chemistry for your body. And if you're not into psychedelics, it's totally fine, but that's kind of like where they can help, is they just open the door on perception for people and give them a new way of thinking. But even just taking time to journal in a certain way, because our society is not conducive to those states of mind. We are in a go, 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 produce, produce, produce type of
Mhm.
mind all the time, when really we're supposed to be like sitting by the river with our tribe, eating our latest catch and talking about the universe. That's really what we're supposed to be doing biologically. But there are
Yes.
really cool resources, like Dr. Rafatjah and I both collaborate with something in Denver called the Zen Den, and they do sober
Mm.
psychedelic experiences. So they use like like a
Yes.
light that kind of creates something called neural artwork, as well as like sound and somatic therapy that creates like a internal journey that can be a deepening experience, collaborated with journal entries and intention. And if there's anything I've learned over time, it's that ceremony is 95% of the medicine. So if you can find a
Mm.
resource, and that one was called the Denver Zen Den, if you're curious, there are ones like that are not psychedelic or substance based, and they're entirely sober, but it's the point of taking the time and making the space for that perception shift, and that can be incredibly
Yes.
healing in a lot of ways. So just wanted to
Yes.
throw that in there.
I loved that article in Westword. I saw you were quoted in it. And so if anyone wants more information, check out the article in Westword on the Zen Den. And yeah, it's really interesting because you could take that concept of how you perceive the world from your brain. You could take it down to the cellular level and bring it down to like the mast cell level of like how cells are perceiving the outside world, and then like seeing more things as a threat than they actually are.
Because if your brain is like, I am threatened, the world is dangerous, your cells are going to be like, I am threatened, the world is
Yes.
dangerous. So your perception says what state your immune
Yeah.
system is in.
Yes.
So that kind of goes right into like my next question is like, what do you think is the biggest hurdle people face in their health today?
I think the biggest hurdle is going to the wrong type of medical provider. Because I think a lot of people think like, oh yeah, I can just like go to my primary care and ask them, about these multitude of symptoms that I'm having. And if they say I'm fine, if they check like 5 of my blood markers and they say I'm fine, then I guess there's no answer. Or I guess I'm fine. I don't need to dig deeper. And I really think that that is so counterproductive. And, unfortunately, that is not the route that's going to get you the actual help that you need. So I think that that's probably the biggest hurdle, is like lack of education and like who's out there that can help, and maybe a lack of trust because, it's not necessarily mainstream yet, so, in a way, I literally went to medical school and got my MD, like knowing that I was going to practice this way, like in integrative and functional medicine, because I was like, I just want to be able to have some credibility. I want people to like believe what I'm saying. And it's like having the MD, sometimes it just does that, and like, unfortunately, having an MD, if you go to an MD with a traditional training that doesn't believe in integrative approaches, they might poo-poo something that would have helped you. So anyway, I think that like having an open mind to seeking functional medicine and seeking integrative approaches and really seeing the resources that are out there, I feel like that's really the main hurdle. And the problem is like most people that are interested and probably listening to us right now, they're the ones that are already in the know. It's those people that really just have no access or no knowledge of this type of approach that are really suffering. And so hopefully we'll be able to get this information out to the masses someday soon.
Absolutely. That's why I do these things. So anyone listening, if you know someone that needs this information, please, please, please share this with them. And, like we always appreciate when you share stuff as well. And it's just like, we just want people to have this information. And, when I was dealing with like a knee injury, pretty bad one, I went to 13 doctors until I found one that was like, I can fix that in the way that you want. And I was like, great,
Wow.
You're my doctor. So just know that you can go interview doctors. I had 10 of them be like, no, there's no way to fix that. That'll never work. You have to reconstruct it. And then on the 13th one, he's like, nope, I'm just going to do this. And I was like, that makes sense. And it worked. And you like can't even tell I had the injury. So just know that just because somebody gives you a direct, blunt, like absolutely not answer, I'm not a fan of black and white answers. If someone gives me an answer like that, to me, it usually means that they're not the most open-minded person and that they haven't done a lot of other research, because I'm a big fan of saying, I don't know. Let me get back to you on that. And I think that is an important thing to do as a practitioner, and rather than just like pretending like when you haven't really done the research.
Yes.
So as we kind of wrap things up here, because gosh, I could talk to you for days. This is just fun. If there was something you wanted everybody to know just about their health in general or whatever, what would you tell them?
I would tell them that there is hope, that, just because you have a diagnosis doesn't mean that you have to suffer or that you necessarily have to be on a medication for the rest of your life. And that there is hope. I think that that's the most important thing to know. And that's coming from a, conventionally trained MD too. And we see it all the time. I was telling Christine about how we did a case review recently, a case study on a random assortment of gut-related diagnoses, patients with a random assortment of gut diagnoses in our practice. And 28 out of 32 people achieved improvement or remission of their gut condition within 12 weeks of working with us. So that's like an 87% success rate within just 3 months. And I'm sure that you see that all the time too, when people have the support. And that's kind of why we at PrimeHealth have this kind of structure. Like, we want people with a chronic condition, if they really want to tackle it, we advise them to sign up for a 6-month program. And I know that you have a similar type of approach, because you want them to be committed. You want to make sure that there's a buy-in on both of your ends, so that you can give them the right information, and then they'll come back for follow-ups, and you can give them feedback based on how things are going and switch things out and kind of like hold their hand along the way. And we also implement health coaching with our patients, so that there's another person involved coaching you along, helping you with lifestyle changes. And within that 6-month period, I mean, the vast majority of people see massive improvements in their health. And so that's why we do it in that way, because we know that when we're both kind of like committed and involved 100%, then we'll see those kinds of results. And it's really been amazing to witness.
Absolutely. And, I have found, like, I have given away more free care on different occasions than I can count. And the people that I do that with just don't get the same results because they don't value it. And so when you are investing in yourself, it kind of forces you to show up instead of kind of, putting one cheek on the chair and not quite being the whole way in. So that is often why it is packages, but also because you can't heal a complex chronic condition in a month. It's like however long it took you to go into it, it's going to take you at least half that long to get back out of it for the most part. So that's why I think, and it's nice to have support along the way, right? Like, I know just in my own experience, I would go to certain practitioners when I was not feeling well, and we'd have a good appointment and I'd be feeling really hopeful. And then there would just be like radio silence for like weeks, and I'd feel so alone. And that's like one of the reasons I do group courses now, is it's like it gives community. And I've even had my clients tell me like, I did so much better in the group course because I actually had people to talk to, because when I'm sick in my life, I can't like connect with anybody because we're just going through totally different life experiences. So I think searching for practitioners and knowing that there's options like this available are huge, and just finding people that you resonate with and like you're allowed to shop around. So thank you so much for taking the time to do this today. This was great, and I love this. I'll be sharing it with lots of people.
Welcome.
If anybody wanted to learn more about you or find you or work with you, where would you send them?
The best place is our website. So it's primehealthdenver.com. And from there, we have tons of blogs and free information for you. You can also sign up for a free phone call, and you can discuss with one of our team members about, how we operate, what our offerings look like, and if we might be the best fit for you. And then also, of course, follow us on Instagram at PrimeHealthDenver. And shoot us a message if you have any questions.
Fantastic. Thank you so much. So anyone, if you want to check her out, you can just click the name and go to her Instagram and follow there and find all the contact information. And same thing, if you want to talk to me, just go to mine, feel free to send me a message. And we're just here for you. And we just want the world to be healthier through empowerment and knowledge, because I think a lot of people forget that doctor means teacher. And so we just want to be here and teach you about your body and how to feel the best that you can in your life. So thank you for taking the time to do this. And if anyone really liked this or you have other questions, I'll be posting it to my feed. And please comment below with your questions, and we can always do another talk and answer them, because we're here for you. So thanks for taking the time today.
Thank you, Christine. This was super fun. Hope to do it again.
Sounds good. Have a wonderful rest of your day. And thanks for joining, everyone.
Bye.